Colorectal cancer is developing silently without many people knowing. This is one of the most common cancers today, ranking 4th or 5th among the most dangerous cancers worldwide. The scary thing is, most cases are only detected when they are in the late stages. Take a look around you. In your family, neighbors, even relatives. Has anyone ever had this disease? Many people may not realize that early detection can save more than 90% of lives if treated promptly. People over 50 years old are at higher risk of colon cancer. Statistics show that more than 50% of people diagnosed with this disease are over 60 years old. If you have a family history of colon cancer, parents, siblings, you should also consider early screening. And in today's video, let's learn about 6 early warning signs of colorectal cancer, so that none of us will regret missing out on the golden opportunity. Dull, persistent abdominal pain of unknown cause. What causes this pain? As the tumor grows, it will press on surrounding tissues, including nerve endings, causing pain. This pain can be in the colon, just rectum, or in surrounding tissues. The pain is not the same as appendicitis, which is usually in the lower right abdomen. Our large intestine, or colon, is divided into several sections. The ascending colon, the transverse colon, and the descending colon, which cover almost the entire abdomen. Therefore, pain symptoms can appear anywhere, not just one specific spot. And importantly, this pain is constant, dull, persistent, not just a stomachache that lasts for a day or two and then goes away. Change in the shape of stool. Next, one thing you may notice is the shape of stool. Normally, our stool is brown and shaped like the colon rectum. However, if there is a tumor in the colon or rectum, the tumor will compress and deform the intestine. This causes the stool to change shape as it passes through the narrow opening. People often describe stool as looking like the tip of a pencil, meaning it becomes narrow. So when you use the toilet, pay attention to see if your stool changes shape. Change in bowel habits. The third symptom you may notice is a change in your bowel habits. Normally, a person's bowel habits include going to the toilet once a day or once every 2 days, depending on the individual. Stools are usually brown, soft, and easy to pass, with a normal shape. However, if you notice that you are having diarrhea more often, and it is not due to food poisoning or eating something that upsets your stomach, it could be a sign. With colon cancer, diarrhea can occur more often for no apparent reason, as it is related to disorders in the colon/rectum. Diarrhea is defined as having more than 3 bowel movements a day with loose stools. This is also a sign of stool passing through a narrow opening and disorder in the colon/rectum. In addition to diarrhea, you may also have constipation. It can be an alternating condition, sometimes diarrhea, sometimes constipation. Constipation can occur because the colon/rectum is the organ that removes waste from the body, but also absorbs nutrients, vitamins, and minerals back into the body. When there is a disorder, or if there is a blockage, a tumor can narrow the passage, leading to constipation. According to statistics, people over 50 years old with persistent, long-term constipation should also consider problems related to their colon/rectum. Weight loss. The fourth sign is weight loss. Weight loss is a common symptom of all types of cancer because cancer cells grow very quickly, multiply rapidly, and consume a lot of nutrients and energy. This depletes the body's nutrients, making us feel constantly nauseous, tired, and eventually leading to weight loss after developing colon cancer. Therefore, unexplained weight loss is one of the suggestive signs. If you are not dieting or trying to lose weight, but suddenly lose about 3 to 4 kilos, 6 to 9 pounds, in about a month, you should be alert to a potential tumor in the body. Fatigue. The 5th symptom is fatigue. In addition to weight loss, you may experience constant fatigue, feeling sluggish, tired, and sleepy. This is because the colon and rectum are the organs that eliminate toxins and waste from the body. When they are blocked, these wastes and toxins can accumulate, making our bodies feel tired all the time. Secondly, it is also related to the body's insufficient energy supply, as more energy is diverted to cancer cells. making our bodies feel tired all the time. This is the fifth symptom that you can recognize when you have colon cancer. Blood in the stool, and the last symptom is blood in the stool. Blood in the stool can be seen with the naked eye if the amount of blood is large. When colon cancer occurs, the blood often protrudes into the colon or rectum. When the stool passes, the blood can damage the lining of the tumor, leading to bleeding. If the bleeding is severe, you can see blood. If the tumor is very close to the rectum, near the anus, you can see fresh blood. But if the tumor is further away, in the right colon, the blood may have to travel a long way before reaching the anus, at which point the stool may turn black and have a foul, burnt smell. In many cases, even if there is bleeding, it may not be detected because the amount of blood is very small. This is called occult blood in the stool. In such cases, you need to have a stool test, or currently, there is a test kit available to detect occult blood in the stool. You just go to the toilet, drop the test stick into the toilet, and if it turns blue, then there is a chance that there is blood in your stool. If you have blood, it does not mean that you definitely have colorectal cancer, but you should get tested to see if you are at risk. Most people with colorectal cancer have occult blood in their stool, so this is one way to detect it. These test kits are not very expensive, usually around 280,000–290,000 VND. You can buy them to test at home. If there is blood, you should get tested again. Finally, act now. Don't wait until it's too late. Here are 6 signs that can help you detect if you have a problem related to colon cancer. Remember, if you see these signs or symptoms, it indicates a potential risk of colon cancer, but it is not a guarantee. You should get checked out for early detection. The best method of testing is usually a colonoscopy, as it provides the most accurate detection. Like John. John had almost no significant symptoms, but on the advice of friends and family about the importance of regular screening, he decided to have a colonoscopy. The results showed a small tumor, and it was promptly removed by surgery. John's story highlights the importance of regular checkups and colonoscopies, even if you feel perfectly healthy. This is a very common and safe procedure today. Don't ignore minor symptoms. Remember, early detection, almost curable. Late detection, high risk of metastasis and complications. Be proactive and go for a checkup if you or a loved one has any of the above signs. If you are over 50 or have a family member who has had colorectal cancer, get a colonoscopy as soon as possible. If you find this video useful, don't forget to share it with your loved ones, because sometimes a small share can save a life. Click like if you find the information valuable. Subscribe to the channel to update the latest health knowledge. Thank you for watching. See you in the next videos. Goodbye.